So thank you so much for everybody making the time to be here and for being so prompt. As always, I have got our CEO, Tim McGibbon, with us. And we are very, very excited to welcome Linda Sheehan. She is the Workplace Engagement Manager for Beyond Blue. And it's such an important conversation that we're going to have. So welcome, Linda. Thanks for being with us.
Good morning. Thank you for having me.
And you are, even though you're a Sydney girl, you're living in Melbourne these days. So that is a bit of a struggle.
Look, I think we're all in this together as
yes.
mental health commission.
I want to sing that every time I hear it, right?
Oh, very good point. But,
yes.
Well, I think we've got COVID fatigue now, and I just don't know, and nobody does, how much longer we're going to be having to deal with this. So I think conversations that we're going to benefit from today, Linda, is going to be so important. People struggle to have these conversations, and I think it's something we do need to work on. I know that people in roles like mine are getting increasingly more concerned about their team and what impact this is having. And I would be surprised if there isn't a lot of people on this call trying to get some tools today to take away so that they can help their team and I would have thought themselves as well.
Yeah, absolutely. And to that end, the plan today for everybody is we're going to switch off our videos and Linda's going to talk to the slides for the initial part of the presentation, and then we are going to come back and have more of a general conversation. So please, if you've got any questions, put them into the chat and I am happy to put them to Linda at the end of her slide presentation. So Linda, I'm going to hand over to you, and Tim and I are going to disappear for a minute.
Fantastic. I've got to figure out how to turn my own video off at this point, which here we go. And the purpose of doing this is just so we have maximum bandwidth on the slides and the video. So thank you so much for having me. I feel very, very privileged to be here. And I guess the purpose of this chat is we're going through some slides. I'm going to be speaking about mental health and work, and we're really going to focus on some of the things we can do. I won't get through everything in the slides, so let's really use the discussion at the end to ask some questions and have a really good chat to get into some of that richer detail. I'm from the workplace team at Beyond Blue, and so my area of specialisation is to help people achieve their best mental health in a work setting. So let's get started. Here we go. To get started, it's useful to think of your mental health as sitting on a spectrum or continuum. The key features of this definition and why this is useful is we're talking about positive mental health, so that green end of the spectrum to the right of your screen, and not just ill health. And there's this idea that your mental health can really fluctuate. It's not a static state. And this is the same whether you've got good mental health or if you have a diagnosed mental health condition. Mental health, just like your physical health, for all of us, is something that can be worked on and positively influenced. So prior to the coronavirus outbreak in Australia, it was estimated that 1 in 5 of us are likely to be impacted by poor mental health in any year. 2 million people live with anxiety, and 1 million people live with depression. Almost 50% of us are likely to be impacted by poor mental health over some time in our lifetimes. And almost 50% of us are likely, I've just said that. Tragically, on average, more than 8 people in Australia take their lives every day, 6 of whom are men. Suicide is the leading cause of death of people in Australia aged between 11 and 44, and it's higher than the national road toll. In terms of the impact of coronavirus on mental health in Australia, some early unpublished emerging indicators suggest that on one hand, people are calling services like Lifeline and Beyond Blue more, but fewer people are seeking treatment for mental health. There's evidence that more people in the population are experiencing increases in psychological distress, and that's at a population level, so everyone is. Significant numbers of people are feeling isolated and alone. Many people are experiencing a reduction in sleep and exercise and an increase in alcohol consumption, and these are known indicators around or risk factors for poorer mental health. And there's a sentiment that it's been in some survey data, but for me it really encapsulates what a lot of people are experiencing. And it says that many people are saying that they're putting on a brave face, but are privately very worried. In advance of this webinar, Kate helped put together some of the really common stressors, and this was good prep for me around what your industry is facing. I've also seen some of this firsthand as well, being both, landlord and a tenant. So I think the things that people are really experiencing at the moment include, we've got these property managers being pulled from pillar to post and really high rates of customer distress and also customer aggression. We're chartering through uncertain times in that we don't know what's next. We've had these periods where routine inspections can be closed, or we can't have in-person options. We have staff concerned about contracting or getting COVID during their day-to-day business activities. And we've got a lot of people facing really reduced turnover. We've got less cash in our businesses, we've got reduced rents, and often it's a time when we have greater staffing requirements because we're trying to manage these workload and safety considerations as well. So what works for mental health? What can keep us well? We know that anxiety and depression are common and treatable. We know that it's beneficial to seek help early, but it's never too late. We know that poor mental health is not a weakness, and we know by talking openly about mental health, we can help raise awareness and reduce the associated stigma. We also know that work is an important setting to help prevent mental health conditions and promote good health. So what are individual level strategies that can help protect and promote your mental health? During COVID-19, evidence-based steps we can all use at an individual level include developing a balanced but adaptable routine, getting good sleep and eating healthy foods, staying physically active, staying connected with family and friends, managing our intake of information, including news and social media, and, really importantly, making use of supports, including informal ones like your family and friends, but also professional services also. Another really common lovely one, which is sort of in addition and where there's growing evidence, are these ideas of grow and give. If you can give back to other people, that can also be incredibly good for yourself. And the more we can keep looking forward, any form of self-development, whether it's a little bit of learning, a little bit of something on the side you want to keep working on, that's incredibly good for your mental health also, because it can help you keep looking forward. It might sound basic, but the basics are important here. It's a critical time to focus on what you can do. So how do we know this works? For example, Beyond Blue recently conducted a national study of over 20,000 police and emergency services workers. And these are people who face regular, really serious stress chronically in their work. And that includes being exposed to some really traumatic events, whether it's customer aggression, public aggression, or seeing awful things in the course of their work. But it's also often cultural factors as well within the workplace. Often these studies tend to focus on what's wrong in these sort of occupations, but the study we did also looked really closely at protective factors associated with good health. How do people in these professions stay well even through really hard circumstances? And the results are sort of what we just said on the last slide. Individually, these protective factors for mental health, and these are represented by the green icon to the left. It includes good physical health, good sleep quality, using available mental health support such as EAP or counselling or going to a GP, and having really strong social connections. And that can be at work, it can be friends, it can be family, but having those people in your life that can pep you up and keep you looking forward. When it comes to work though, these individual protective factors aren't quite enough. In a work setting, we also need to consider organisational level protections. And that can be if you're in a big organisation, but also even a really small business as well. It might be 2 or 3 of you, but how you work together and some of those settings factors are really important also. The organisational protections for good mental health, and these are represented by the purple icon to the right, which I appreciate does look a little bit like some of those coronavirus icons, but it's having a good work culture, including fairness and respect. It's flexibility and work-life balance. It's being in an environment with low levels of stress, gossip, and bullying. And it's having high levels of social support, meaning having good social connection through work. To help apply this, there's a model called the integrated approach. And this is just trying to really simplify 3 key areas where we can look to individually and in a work setting to help look after our mental health. The 3 core elements are protect, promote, and support. This means protecting from risks to mental health, promoting good health, connection and culture, and supporting people in times of need. And in a group setting, these are usually enabled by good leadership, communication, and participation, represented by the middle. By addressing the elements of promote, protect, and support, we can help people, if you remember that mental health spectrum at the front, we can help people stay healthy in the green. We can protect people who might be at risk of developing a mental health condition and support people in times of need. So the slide now, if we want to aim for those goals, protect, promote, and support, this shows the types of interventions we can do at a workplace level. And this model, it was developed by New South Union, the Black Dog Institute. And across the bottom, you'll see 6 green icons. And these shows the things that we can do practically to help promote good mental health. These include number 3 is individual, and this is about personal resilience. It's how we can strengthen those at risk. Number 4 is about promoting and facilitating early help seeking, and we'll go through some options for that today, which are free even if you don't have access to EAP. Number 5 is supporting people with a mental health condition, and we'll also touch on that as well today with some of the free resources available. Number 6 is about increasing awareness of mental health and reducing stigma. So for everyone who's joined us today, congratulations, we're already on this journey. I think generally Australia's done a really fantastic job of starting to get better in our conversations around mental health. Where a lot of opportunity sits for us and people generally is around number 1 and 2. And this is how we really go about our work, our job design to promote good health. It's the really positive, protective things, the way we plan and develop the positive aspects. And secondly, how we protect from those mental health risk factors. If we know there are stresses out there due to COVID, if we know that we have people facing customer aggression and everything else, what can we do in advance before people start to become unwell to keep people well or to prevent them from becoming sick? So what are these known hazards? We've touched on a few already, but these are the ones highlighted by Safe Work Australia. Across the top, they're in 3 categories, and they're individual ones. So things you might be experiencing now include overwork and underwork. People are both experiencing at the same time. There are organisational and environmental risks. So these include things like if there's a lot of rapid change around COVID, if there are changes in regulation, if there are if there's new financial incentives coming out like job seeker and JobKeeper and some of the protections there. I think all that change can be a really common risk factor, and that we're struggling to keep up, and there's a lot of emails coming in and we're just trying to get on top of all that information. So that's a really common and known mental health risk. And then we've got these occupational hazards as well. Really common and known occupational hazards for mental health include isolation. If you spend a lot of time on your own, and that can be whether it's out in the field. If you're commonly doing things by yourself, that can be a risk factor. Likewise, having so many people working from home for the first time as well is a common risk factor, in that we're not quite used to it and it's not by choice for many of us at the moment. On the bottom now, though, there are these known protections, and we really want to start now focusing on the good things. What's all the stuff we can do to really look after and protect our mental health? Importantly, protections don't need to map directly back to risks. So there might be things you can't manage at the moment. It might be that there's increasing parts of the pandemic that we don't know what's coming next. But there are different things we can do. And by focusing on the protections within our control, things like culture, things like getting a bit of extra training in, things like really reaching out and looking after each other, and just looking at some of the flexibility and ways of our working, these are things that we can use to really prop up and protect us from some of the things that might be outside our control. So to give you an example, and before I go on for too long as well, please feel free to jump in with any questions while I'm speaking, but of course we'll have that discussion time at the end. So I understand there are a lot of small business owners or people that are working in small businesses on the call today. Some really common risks that pop up in small businesses are long working hours, cash flow. There's not many other people to help during busy times, so it's that sense that you've got all this responsibility on your shoulders. There's a lot of work insecurity and a bit of isolation. We have small businesses, of course, across all industries, but it's really, really common in real estate and property. There's a lot of research that people in small businesses, and particularly small business owners, are actually experiencing, even before COVID, higher rates of psychological distress than across the normal population. Small businesses are huge. They make up 2.3 million businesses in Australia, and they employ almost half the workforce. 23% of micro-business owners, micro-businesses being, I think, fewer than 4 people, they report a high level of psychological distress. 25% of small business owners report a high level of psychological distress. And 36% of sole operators generally report a high level of psychological distress. And this is on a scale, high is the highest level. There's also experiencing some distress, and then lower levels below that. So generally, small business and small business owners proportionately have higher stress in normal times. Some of the really evidence-based protective things we can do to help manage this stress include, if we think about protect, some of the really simple things like leaning in and budgeting, accessing business support and planning. A good analogy here is if you're in financial distress, it's important to actually keep an eye on your expenditure, going through line items and developing a budget. It's not a time when you sort of stop looking at the balance and what's going on there. The evidence suggests the more we actually start to manage risks that we're facing and issues within our control, we can start to feel better about them. A good analogy is the positive feeling when you actually respond to the emails in your inbox, as opposed to that feeling of dread you might get when you open up your inbox and you have a heap of work in there that's not yet done. So that process of taking action is really good for your mental health. Related to this, there are some business wellbeing plan resources that have been developed by Beyond Blue, which we can show you a bit later in the presentation. Accessing peer networks, and really leaning in advance into some of the government toolkits and supports out there. Promote the simple things we can do. Continue to make sure you're looking after your physical health. Develop connection, and really think about options around peer networks out there. A really common protective strategy and to promote good health that we've seen good effect in small businesses is to seek out even informal networks to find other people going through what you're going through. And that's where organisations like the Real Estate Institute can be really powerful, in that it's connecting you in with others in a similar situation. There's some really good evidence-based mindfulness apps out there. Most people have heard of Smiling Mind. They've got an at-home version during coronavirus. There's also an app I'm a big fan of, which was developed by the Black Dog Institute, targeting men. And the research and the mode of this app is they've tried to strip out all the fluffy stuff around mindfulness, all the discussion of psychology and the why and how, and they're really focused on action-based activities. And the research around the Black Dog app is it was shown to have a really strong preventive benefit for people using the app, for both men and women. So there are some really good apps out there which the evidence shows can help protect and reduce mental health distress. Also, it's a really important time to seek support. Use those professional supports. There's a Beyond Blue service which has been added on during coronavirus, which is free and a really good option for businesses that don't have access to EAP. I'll start jumping ahead now. There's a recent Australian research study on things you can do, businesses can do to help promote good mental health during the recovery, the opening up aspects of COVID-19. This addressed risks such as changes in work, uncertainty, some of the risk around further waves, economic risk and vulnerable workers. And the evidence again and again has shown that what can help people in these circumstances is really good leadership matters. People don't expect leaders to have all the answers, but to make reasonable and informed decisions with the best info available. It's about being present. It's about being accessible and communicating well. Communication pops up again and again as one of the most important things in helping a business reduce stressors for customers and employees. It doesn't necessarily mean lots of communication. It's about regular, effective, clear, concise communication. So an example might be having a regular team catch up where you really clearly state priorities and updates for the week. It doesn't have to be every day, it doesn't have to be every hour, but it's about the consistency, the clarity, and giving people a sense of certainty about what the business priorities are. Participation is really important. If you do work with others, try and include them and try and get feedback from them about the things that might be impacting them at the moment. If you've got a slightly bigger team, it's a really important time to continue doing staff surveys. And most organisations we're speaking with find that they can be a little bit reluctant going into a staff survey, but they're usually very grateful afterwards because you can confirm some of the things that you thought people are going through. It might identify some positives that you weren't aware of. And it also can help identify some risks that you can start to manage that you might not have been sort of across. It's also a really good time to develop or review a mental health strategy. For bigger businesses, there's free New South Wales-based support out there to help you develop a strategy. For smaller businesses, there are some really easy, accessible tools and apps out there, which I can show you again on the next slide. It's also a good time to focus on some of the benefits of COVID. I don't mean to sound too trite there, but there have been some real progress in terms of online connectivity. Generally, it's much easier to do business now over Zoom than it ever has been before. We've seen real advances in flexibility. A lot of businesses now, we can work from home now. We do have a little bit of flexibility in our hours. And statistically, people are reporting some real gains from this in terms of reduced commute times and more autonomy and control in some aspects of our personal lives. There are some really great tools out there which I can show, or we can email around afterwards as well to help here. So what are the signs? What are the things that we should be looking out for in ourselves and each other? A good tip around mental health literacy, and that's your ability to recognise signs. is that most of us generally aren't very good at recognizing our own mental health. We tend to overestimate where we're up to, and we wait too long before using care strategies or seeking help. There was one study which showed that with anxiety in Australia, people were waiting on average up to 8 years before seeking help after first showing signs of distress. So the things we can look for include things like if your sleep is impacted, so that you might wake up during the night or you're waking up quite early with racing thoughts. That's a really common factor that you might be able to benefit from some of these mental health strategies and things out there. It can also be that sense of it's taking you much longer to do something than it used to be really quick or with you before. But it's these changes in yourself. It's not feeling that great physically. It's not feeling like yourself in terms of your feelings. It might be that sense of being overwhelmed or indecisive. It can be negative thinking patterns and really those changes in your thinking from your own normal. And also there's a few common behaviours such as withdrawal, or if somebody's usually quite quiet, being a bit more, it's that sense of being off, whether it's yourself feeling a bit off or somebody else feeling a bit off. There are some really great tools out there that you can use to help triage yourself, or you can even think about to look at somebody else. And these are available on the Beyond Blue and Black Dog websites. These include triage tools which can be used by GPs. So some of them you can click in, you can do a screening test. They're really evidence-based. These are the best practice tools out there, and they can even now link into some of the free online clinics available. Really great, we can send those links out afterwards. In terms of the free things out there, Beyond Blue has a website, headsup.org.au, and this includes a range of workplace resources. This is in addition to the usual Beyond Blue website, which has all the content around self-care, seeking help and looking after yourself. Another great tool on the Heads Up site, so this is one of those workplace-based tools, is a Wellbeing Plan. This is something that anybody can do for yourself, and you can do in a business context. It's kind of like a exercise strategy, but for your head. And it's a really good example of healthy you looking after you on not such a great day. The purpose of this tool is it can be that check-in if you're not feeling great. So you sort of start in, it's just a Word document that you can fill in for yourself, but remind yourself of all the reasons you might have for being at work. Some of those values due to COVID might be a little bit changed. So if you travel a lot, that might not be on the cards at the moment. But this can be a really good way to remind yourself of some of those things you can still do. So you might still get flexibility. You can still put food on the table. You can still help people, and you can still, you know, if you love houses and seeing interiors as opposed to sitting staring at spreadsheets all day, there are still all those good reasons that we love being at work. Then these plans work through, and it's a way to help really individually start listing out some of your triggers. And it might be things like not getting enough sleep, not getting your morning coffee, just the little things that you know can press your buttons. And then working through some of the warning signs, but also recovery strategies. So if I'm having a bad day, I know that going for a walk with my dog will always make me feel better. If I'm having a bad day, there are certain songs I can pump on my phone, and it's always that little pick me up. Or there are people I can call or message or just reach out to, and it's always somebody I know that can boost me up and be there for me. And what these plans do, they start to remind you of when you might be starting to fall a bit off, and some of the strategies you can really start to play back in to help yourself feel better. In New South Wales, for businesses with fewer than 200 employees, there are some really great free online training programs out there. And when I say online, these now have online modular components, but also online Zoom components also. So you do get that face-to-face interaction. These are run by the Black Dog Institute, so they're the best of the best evaluated training. And it includes mental health skills training for staff, and mental health manager training. So some of that manager capacity of how to help others. any business with fewer than 200 employees in New South Wales is eligible. It's a New South Wales workers' comp policy, or if you're a sole trader, you can access it also, I believe. But it's, you go to the Safe Work New South Wales website. I've got a screenshot on the screen there, and you can apply to use those programs and get that great training. There's also a direct test consultancy service available as well. And that's really going in and looking sort of at that policy and procedure approach to give you a bit of help. They're free, they're confidential, and they're all evidence-based. So some really excellent options for New South Wales-based employers and smaller businesses. The last one I'll quickly touch on is the Coronavirus Mental Wellbeing Support Service. It's a federally funded platform created during COVID-19, and it's really a great service for anyone in the community to access, but also for businesses who might be too small to have EAP. You can call anytime, it's there 24-hour. There's now a web chat option also, and you'll be linked in with trained mental health professionals. They're also briefed on available coronavirus supports out there. So things like the debt recovery lines and the government programs, and they can link you in with some of the free and public health services. To give you an example, there have been a number of changes around better access, the system where you can go to GP and get a free mental health plan. That's now available online, which it couldn't before. It used to have to be go in person. So to give that example, you can call the Coronavirus Mental Wellbeing Support Service if you have no idea how to access that. They can help link you to a GP, get a referral, and you can do it all for free from the comfort of your home. So it's also an option to help others. If, for example, you have a friend or loved one or employee that you're worried about and you're not quite sure how to help them, you can call many of these services and just talk it through with someone, some of the ways to work through it, get help for yourself or get help for others. There's a range of digital content on there as well, with articles around working from home, self-care, impact on work, or even if you might have a coronavirus diagnosis and some of the strategies and things you can do. People are welcome to use that content on their intranets, on EDMs, on websites, on social media. We want the information out there. We want it shared so that we can all help get better. This is my last slide, and we can probably turn the videos back on soon. But just to end, I really wanted to encourage everyone watching today just to remember about self-care. Take a break on your break, have a technology switch off, get to know what works for you. I mentioned before, my dog helps me a lot. That's a picture of him on the video there. Consider also some of the free apps. There's some screenshots there of Headgear, one of the Black Dog apps, and Smiling Mind. But out of this today, I give you two challenges. One, please take a self-care activity with you into your day. Think of one thing, whether it's going for a walk, checking in with a friend. It might be looking up some of those training options out there that we looked at. But also, challenge number two, what's something that you could do for somebody else? It might be someone you work with. It might be something you can contribute to your workplace. But I hope there's something in this presentation today that you can take with you, share, and help promote some of those mental health messages to promote mentally healthy workplaces. That's all for the slides. I'll stop sharing, and I'm really looking forward to the conversation. So
thanks so much, Linda. That was really, really interesting. There's a lot of really important conversations to be having in that space. I would invite anybody, if they've got any questions, now's the time to ask them. But you and I were talking about the fact that people can lose their purpose. So, for example, in real estate, a lot of us love to travel, particularly overseas, particularly to get out of the cold. And I was speaking to a really high profile agent this week, and she said to me, Leanne, I've lost my purpose. Business is okay. She's not in Melbourne, so business is going okay for her right now, but she feels like she's lost her real why. And I think a lot of people are used to having things like travel, for example, to look forward to. So how can we go about maybe reframing some of those things that we used to look forward to and yeah, get that purpose back?
It's a really great question. I think it's something many people have grappled with, and maybe we can all think of a few examples, each and every one of us. I myself, I'm someone who loves to travel. I usually used to get to travel a lot in the course of my work. And I think I was mentioning to Leanne at the start of this call, I was down in Hobart at the start of March, before I think we all really appreciated where this was going. But there's a word you mentioned there, reframing, and I think that's really important and crucial at the moment. And if you recall the Wellbeing Plan that I showed at the start, a really common and practical thing we can do is, if your purpose is travel, it's probably not your only purpose. There are usually a number of reasons we have if we really start to reflect on our values and some of the core things around what we can like and what we can be grateful for in our work. So to work through my own example here of how I approach reframing, I might not have the travel, but I do have the option to still, even though I'm working with home, I get to regularly communicate with people, like this webinar today. I get to meet great people. I get to put food on the table, which gives me that sense of autonomy. And I would much rather be in work than so many of us who have been impacted by work loss or work insecurity. So right now we're starting to see, I think another really common thing that I've heard in property is some of the flexibility it can give people. So it might still be the option to be more involved with family or friends, or just flexibility to do, in my case, an at-home gym class.
Yeah.
It's reframing to some of the positives, some of the things we can still do, work towards and influence.
And it's so important to be looking towards what we can do, not focusing on the things that we can't do. And that whole gratitude piece is so important, isn't it?
Too right. Do you and Tim have any examples there as well, either for yourself or any of the people?
I have a question in relation to the illness, if we can call it that. If somebody has a physical disability, it's on show, and the community has some empathy, some sympathy for that, cancer and a variety of other illnesses. And yet, when you said just how widespread that a mental illness is, and yet there's so little discussion about it. It strikes me as odd that it doesn't get more sunshine, if you will. And why is it, do you think, that mental illness is something that we don't want to talk about, or don't want to put our hand up and say, you know, I have a mental illness, I have some difficulties in this area, depression, anxiety. Why don't people do that?
It's, again, another really good question. There's a police and emergency services study I referenced in the presentation, and a really interesting finding there was, generally in Australia over the last 20 years or so, we've got a lot better at wanting to help each other. I mean, I sort of imagine even 10 years ago, we probably wouldn't be having this webinar today, technology aside, but we wouldn't be having a conversation around how to really protect our mental health quite so openly as we do now. What the studies are showing, though, is there's still really high rates of self-stigma. So we might want to help our mates, we might want to help each other, we might not see helping others as a burden, but noting that the mental health conversation in Australia, it's come a long way in the last 10 years and 20 years, but that's still not very long. It's a really recent time. And if you think of so many sportsmen and sportswomen and leaders who have come forward really transparently with their mental health journeys, a really common theme of those discussions is that the fear of speaking up, the sense that, and this perception that we don't want to have a mental health condition.
Well, people are going to think that you can't do your job. Right?
Well, yeah.
And it's not just if, you know, certainly as a leader, if you're a leader and you admit that you've got some mental health challenges, then people are going to be concerned about your ability to lead. But even if you're not a leader, if you're a property manager that's under stress, you don't want to necessarily put your hand up and say, I'm having some mental health problems, because the business owner might immediately go, oh, actually, maybe you're not suitable for this job. So people are concerned, right?
That's where the data is really interesting, because it's sort of suggesting that our fear of what others will think of us is actually worse than what others will think of us.
Yeah.
So generally now we're starting to know that it's much better to seek treatment. It's so normal. It is so common. It's such an important thing to do something about. And one of the benefits of the pandemic is it's actually brought this out of the cupboard. We all know that we're going through something stressful, and the more we can start to talk about it and do things about it, the less of an issue it is. I mean, often the worst thing we can do with this is forget about it and really try and pretend it's not there. I think there are some really beautiful leadership sentiments we've seen out of military and defence and really high caliber professions about mental health as a strength, and that importance of looking after ourselves and each other as a sign of strength, as an aspect of resilience. And the stoicism is actually in looking after your mental health. It's looking after your sleep. It's looking after yourself and each other. It's seeking support early while it's actionable. That's to say it's never too late to seek support. But I think the dial's turning there. And I think that's why conversations like today are so important, to help continue challenging and changing those beliefs. And one thing we can all do is, the more that we make it acceptable to talk about mental health, the more leaders and influencers, whether it's, even if you only influence one person, if you can normalize a conversation, if you can share positive examples of mental health, that will help people in ways that you might never appreciate or even know about, that puts those positive messages out there.
The thing that took me by surprise, and you're right, it has started to come out in the conversation, and people are putting their hands up, you know, to say that they have some issues in this space. But I had always thought that somebody with a depression or anxiety would be somebody that was a bit fragile. They were just made fragile. And over the last few years, when people have been stepping forward and saying they do have these issues, and we're seeing some of the footballers in some of the really rough codes of Australian football. These people are 6'4" and huge men, and they're saying, no, I have depression and I have anxiety and I have this and I have that, and you just can't imagine that somebody that huge would have anything to be concerned about. They've just marched forward, and as I said, just huge big men that be frightened of nothing.
But it just doesn't discriminate, right? We've got lots of examples where people that are very wealthy, very successful, whether it's sporting or business or in media, it just doesn't discriminate.
It does.
Yeah, well, while we're talking about an understanding of what depression is now, and again, I'm somewhat embarrassed to have to say this, but I thought depression was when my football team got beat. That made me unhappy, and I was depressed about that. But I didn't really understand that it is a medical condition, and I think the terminology of it, people say, oh, well, I've got to do this or I've got to do that, and that is so depressing. And because of that, it's wrapped together. But as I understand it, at least, is that it is a sort of a blood disorder. There is a disorder that, and I've heard the serotonin or whatever it may be that circulates, or not enough of it or too much of it, whatever it is. But the word depression, as it's used in our society, is or something is depressing is grossly different to actually having depression.
I think clinical depression, and to maybe give I think one of the really hard aspects of depression is it can take away your ability to use your resilience toolkit. And if you think of that spectrum at the start, with the green at one end and the red at the other, when you're in the healthy end, it sort of means that you can really use some of those resilience skills. It's where you can lean into it and help yourself stay well. As people start to slip into the amber, I think that's when you can really, it gets harder to use those skills, but you can sort of claw back. And when people are quite unwell, it's an illness. It's that they can't often, well, they'll need help. And that's why the support aspects are so important, and reaching out and being able to recognise.
But there's different kinds of depression though, right? There is clinical depression, but there is depression brought on by situations like what we're going through right now with COVID.
Well, I think it can be both. So if you have clinical depression, for example, a lot of people with conditions can be exacerbated. I think a common term we heard was that people feel very heightened by what's happening, whether that's anxiety or depression. But if you think of some of that presentation, we know that there are these systemic stressors that can impact anyone. And they could contribute to people getting a diagnosed condition who may not have had it before, or you can have this other stress. So I'd really encourage probably less around, it's not the diagnosis. Diagnoses are important, but it's more around what are we seeing and how can we access the help, and making that a positive as opposed to a negative. So I think they're probably the key takeaways.
Yeah.
Linda,
so I've got a question, if I may, Tim. Firstly, Kate said, yeah, absolutely right, Tim. It's important to understand what mental health actually is. Linda, great talk. How is it best to bring up the topic of mental health? Would you suggest bringing this topic up with the team as a whole and then talking to each member one-on-one, or follow up the team chat with something like an online survey to gauge how everybody's feeling and seeing if they're wanting to talk about it?
I think they're both great suggestions. Every team's pretty different, and it depends on relationships in the team. There are some really good conversation starters and resources out there. There are also some things like Beyond Blue has a speakers bureau where you can have anyone, any organisation out there can have somebody share their lived experience story, currently over webinar, but share those personal stories in a setting. And there's a lot of videos out there, there's a lot of content out there. So we can share some of those links afterwards.
Right.
But Kate, for your question, I think either of those are probably okay. It would depend on the circumstances, but getting something really nuanced for your team and those relationships.
And are there any surveys available in the resources that you're going to share with us? Are there any sort of examples of surveys?
There are a few, so we can send those links out. There's also currently a project called the National Workplace Initiative at the moment in Australia, which is working towards trying to harmonise. There's so much information out there, so trying to get it together in one platform. So if anyone's really interested, that's open for consultation while it's being developed. So we can send those links as well.
Great.
Linda, I'm becoming increasingly concerned about our members. It has started obviously in the property management area, and what happens with a property manager, I think, is that they've got 100 plus 120 properties that they're managing, and they're having difficult conversations with the tenant and with the landlord, and they've got all of that stress coming in. And after they've dealt with property number one, they then move to property number two. And that has got to be impacting those people, and that is concerning me. And as we move forward, I think that we're going to see that in the sales world as well. I mean, over the last 10 years or longer, it has been the case that somebody would make a little bit of money on the sale of their house, or a lot of money on the sale of their house. And now it's not going to be that. I fear. We haven't seen it yet, but I fear that may be the case in the latter part of this year and certainly into next year. And that stress is also something that these people are going to have to take on. And to Leanne's point, and I think she's right, that this is an environmental influence that's going to trigger that. And as where the institute sits, I'll be looking for tools to be able to help these people, something that they can come to. So if there is some support system for our organisation we can connect into, I'd certainly be grateful for that.
Well, very keen to share. And I think a brief summary of what you just said, there's a comment you made about the stress we take on. And I think this is about how we manage, we need to take on the concerns, we need to act on the concerns, but I think it's about how we manage some of those stresses on our shoulders and how we can re-perceive some of our ways that we're thinking about it. It's never been a more important time to seek help. A really common thing that we tend to see is people, I sort of mentioned that we wait too long to get help. You can call those support services, pretty much anyone could at the moment. You could call, ask some questions about mental health, about things you could do, some supports out there. We'll send some of the digital content and resources out there, but really it's for self-care and self-compassion. It's the little things you can do every day. It is making your own wellbeing plan. It's the little things. It's having a walk. It's getting good sleep, staying connected. And a lot of it's not going to sound glamorous. There's no silver bullet.
Well, see, the thing is, it sounds so simple. And I've had this conversation with so many people. For me, I have to exercise. Yeah. And during COVID, I've never been a runner, but during COVID, because I couldn't go to the gym, I just felt like I needed to run. So I started to run. I think, you know, if you listen to yourself, you kind of get the clues as to what potentially might help you.
Another, this might be a very popular view, but another common one we've heard is a few people intentionally managing their booze a bit differently. A lot of people have been drinking a lot more. Yeah. So having a few cutback days or cutting back on average can really help your sleep quality and give you that sense of control that you might be lacking elsewhere in your life. So another little practical example that would maybe also save some money too. So
yeah, absolutely. I've got another question. How should somebody help with a person in their team who has already, they're already aware that there's a mental illness there, without having them feel as if they're being judged or letting the team down when they're taking some time for themselves?
Such a good question. I think there's a few different layers you can look at that. One's environmental, one's trying to create an environment that supports mental health conditions. So if you're even in a really small team, if you come back from this webinar and you say, just saw a presentation about mental health, here's some great information, here are some apps, I really support this, I think this is such an important thing, and everyone that does this is a legend. That's tick one. You're creating an environment where it's safer to talk about mental health and more dignified. So that's a continuum thing you can do. And then I think when you've got that environment, it then becomes much safer to have those private, confidential conversations with people. The Wellbeing Plan example I made, one thing, if people do feel safe disclosing in a workplace context, and I can link as a disclosure tool that can help people decide whether they want to tell at work about having a mental health condition, because not all workplaces are there yet. So there are some tools out there. But if you are in a safe environment, if you're with someone you trust, and it doesn't have to be with everyone, it can be in a very close circle of trust, sharing that wellbeing plan can be a really good thing to do. And one example where I had a lady I worked with who had a diagnosed condition, and in her wellbeing plan, it said, if I'm not feeling great, I'll often ask to go home because I want to be alone. But that's actually the worst thing for me, because I often get worse and then I'll dwell. So if I ever do that in that circumstance, just ask me if I want to go get a coffee or go work in a cafe or go sit in one of the meeting rooms for a couple of hours. Just reset. It might be having a little bit of time away, but that's one little strategy that works for me. So sharing a wellbeing plan in those circumstances can be a really lovely way just to give the person control and dignity and a say in proactively and positively managing to stay well, even with a mental health condition.
And great strategy. Is this an issue in our society that is more prevalent now than it was 20 or 50 years ago? Is it because of the environment we live in, or some other factors that have impacted us, our diet, or whatever the case may be? Has it exploded now than what it was years, or are we just shining a light on it, or is it a bit of both?
I think it's the shining a light on it. There have been, just to give an example, and I've put some warnings ahead of this, but in most jurisdictions, suicide was illegal until very recently. So there's also been a lot of stigma around mental health conditions and some very poor treatment of mental health conditions in the past. So we've been pretty good for a long time at not talking about it. So I think talking about it is the new thing. Getting help, a lot of treatment has improved. And actually this focus on prevention is that's new. And I think it's hard because it is a bit new. We've got to get over that old stigma. But I think this has been bubbling away for a long time. And to give another example, I think after most of the Great Wars, there have been different labels on a lot of the mental health conditions people faced afterwards. You think of different the depression and other times in the past. It's very closely linked with other incidents of family violence and those sorts of things. I'm not saying it's correlated, but it's the shining a light on it that matters. It's been there and we're acting on it. And I think that's the key takeaway.
I'm mindful of time, so if anybody's got any last questions for Linda, now is the time to ask them. What would be the last message you wanted to leave everybody with, Linda?
Probably just reiterating from the end of the presentation. Take something today to look after yourself. Be kind to yourself, and really think of something we can do to influence others. So in your workplace, a colleague, friend or family, you can take something from today and share it. That would be incredible. So, and yes, to answer Jess's question, we will send resources and links around.
Yeah, beautiful. There's also just one more question. Should we not so much as push, but suggest we believe it's best for the person to stay at work, who's coming forward and saying that they want to go home for the day due to their mindset?
It really depends on the circumstances and the person. So
it's about having that plan, right? It's about having an environment where you can have the conversation, you can get them to put their plan, their personal plan together, and then that way you know, as their leader, what the best way to move forward with them is.
And even then, they're an adult, and we need to do everything reasonable. And if that person makes the call, they make the call. So I think it's about giving them a say, giving them respect, and working with them.
And how do we approach it without having them feel like we're not caring about them?
I think doing it in a way that shows care is really important, and demonstrating trust. So different people respond differently. Mental health first aid can be a really good strategy and tool to help with some of those conversations.
Yep.
There's another program out there called Assist Training, which can help. It's applied suicide. I've got the acronym wrong. I can't think of it right now. But it's really if people are in that very critical state, how to have a safe conversation with them as well. So there's some really excellent tools out there.
Sounds like there is. Yeah, there's lots of resources, and obviously we will email that out to everybody. Anything you wanted to say in closing, Tim?
Yeah, one of the things that you did say, Linda, which I wasn't quite ready for actually, but was so important, because I was coming at this from the perspective of you can give me some tools that I can identify with other people, because this is another person problem. And you said quite a lot of your presentation was all about keeping an eye on yourself and looking for those indicators yourself, rather than, and I think managers in particular are out there looking at their team and forgetting about themselves. And I think that was such a great message that people should take away from this. It's not only about other people. This can be impacting on you, and to keep an eye on yourself. I notice, and the analogy I'm thinking about is in aircraft back in the days when we used to fly in them, is that when the mask falls from the roof, they say, put it on yourself before you put it on your children or anybody else, because unless you're okay, you can't help anybody else. And I think that was something that in your presentation I probably wasn't ready for. And
I think by leading that example, you are helping others as well, in that you're creating that environment. You're accepting that this is important and modeling those good behaviors as well. So it's like any good behavior. If you're polite, you encourage politeness. So
yes, Tim. If you're polite, you encourage politeness.
That's right. That's the reason I'm polite. But it's such a good time. I went to a leadership seminar once, and the person who was giving it said, if you are a leader, and I remember this clearly, said, if you're tired, don't be tired. If you're sick, don't be sick. And if you're frightened, don't be frightened, because it just goes straight through the organisation. And that makes sense. But gee, what pressure you're putting on the leader of an organisation when that is the thing that you walk out of the room with.
Mental health is an enabler. It's an enabler for business. It's an enabler individually. And I think to help everyone through this hard time, if we can keep building up ourselves and our others, it can build that flexibility, that responsiveness to keep rising with the punches and stay strong. So
yeah, thank you so much for taking the time, Linda. It's been really worthwhile, and we very much appreciate it. So thank you.
Thank you.
Thanks, Linda. Appreciate it.
Thanks, everybody. We'll see you next Friday.